The purpose of our session today, I'm so excited to have this session. I've been looking forward to this so long. I've been really inspired by the Core Humanitarian Standard, which we've Anne Sophie joining, so I'll let her in. When I learned about the details of what's included in the standard, I was so impressed that there is element in the standard which was developed by the sector for the sector, looking at well-being, recognizing that our staff are crucial to delivering effective aid, people at the center. And if we don't have well staff, we won't have effective support for those people that we serve. So there's already a lot of elements in the standard related to power, related to care, related to culture, but a lot of people don't know about it. And if they do know about it, they don't have a lot of time to talk about it with others. How are we doing? So we're going to explore together today what exists in the standard related to care, culture, and power. We want to share experience. We've got some great people here today who have been looking at the standard and applying it in their organizations. We want to share experience from CHS verified organizations. And then with your help, we'd love to consider, given what we have, what are the strengths and weaknesses in the sector, and what can we do to strengthen or add to what exists already? So that's kind of in a nutshell what we're going to be doing today. We will have a presentation by Bona about what exists in the standard. We'll follow it by Reza, who will share from Coast Trust perspective what he's seen there. And then we will have, with the help of Alan and Anne Sophie, we will have some facilitated conversations. So I've got some people coming on screen. You're all welcome to come, as many as we have space for. I'll be bringing you in. But just as a kind of intro, that's kind of what we're doing today. I hope it's clear. Over to you, Bona.
I hope some of you know CHS already, where we have these 9 commitments in the CHS, and each of the commitments are composed of key actions and organizational responsibilities. And we can see that when we try to look at the element of care, culture, and power, we see 10 indicators that are covering elements of this topic. It is cross-cutting through the CHS, and this is covering in 6 commitments from out of the 9 commitments that we have in the CHS. So we see that we can group them under 3 main topics that are covered in the CHS. The first one is assessing and considering social, gender-related, and power dynamic within the communities and within the organization before entering in contact with people and working with them. The second topic is creating culture of open communication, allowing everybody within the organization and within the community to talk, communicate, complain, share complaint and feedback regarding the programs that we are doing. And the third one is to establish and apply policies for the security and well-being of staff, including having a zero tolerance for no action on harassment and abuse. These are the 3 main elements that we see are covered in the CHS already. Now we want to ask you to share your knowledge on what you know in the sector. We see the screen, but nothing on the screen. We want you to give your, as I was saying, share your knowledge, because we know everybody can estimate where we are in the sector, the way we are addressing care, culture, and power. So what we are asking you to do now, we have selected 5 indicators from the CHS, which are covering care, culture, and power. And we want to ask you to score these indicators through the poll, a poll that we will share with you. to score them based on your knowledge within your organization or your knowledge of the sector. Then we will come back and see how CHS verification data are showing, what CHS verification data is showing regarding these topics. Now, Melissa, can we launch the poll so that I explain how?
See, sorry to interrupt. You will see next to the video, there's events and sessions, and on sessions, there's chat. There's also polls. So if you click on polls, you can see we've created different polls per indicator of where you think the sector as a whole is performing. So if you can just click over to polls and fill those in, we'll show the results.
So you have in the poll, you have indicators, and we ask you, when we ask you to score it, you have 5 elements to choose. You have 0, which says not working toward applying this requirement. So if you think that, for example, I take, how do you think the sector performs encouraging stakeholders to report abuse of power? This is related to indicators 9.5 in CHS. So you, from your knowledge, you will say in my organization or in the sector, I think this will be 0, 1, 3, 2, or 3. 0 meaning that not working toward applying this requirement. The 1 is making effort, but not systematic, few efforts, anecdotal effort only. And the 3 is systematic effort, but we still have key points to address. The 3 is systematic, ensuring that the requirement is met through all the organization and over time. And the 4th one is beyond the requirement, exemplary and innovation application. We tried here to shorten the description of this score that we use in the CHS verification as well. So we ask you, we give you a few minutes to fill this poll, and we will look at the result and compare that with the result that we get from the CHS verification.
While people fill out the poll, Helen has figured out how to share the slides. So maybe you can give her some guidance on which slide you'd like her to land on.
So the slides that I can see also as well is where we have these 3 topics that are covered in the CHS through the 10 indicators that is in the CHS. So when we are doing it, we can go to the next slide to show people about the poll that we are doing. This is where we explain the scores. So just wait for you to fill in the poll. Can we also show the result as we go?
We have, for example, on 9.5, how do you think the sector performs in encouraging stakeholders to report abuses of power? The most votes, 62% of the votes went to the level 1, making efforts but not systematically. Do you see that, Bona? 8.9, do you think the sector performs policies for security and well-being of staff? Again, most people think it's level 1, making efforts but not systematically. Indicator 5.5, how do you think the sector performs having organizational cultures in which complaints are taken seriously and acted upon? Again, most people think level 1, score 1.
Oh, we are all 1.
How do you think the sector performs in assessing social and power dynamics? This is something Hope Chigudu, our co-host, is talking a lot about. Before they decide on the best ways to interact with communities, again, most people think score 1, making efforts but not systematically. How do you think the sector takes into account power relations and negative effects in the areas of culture, gender, social political relationships? Here we got actually half the people thinking 0. We're not working at all to apply this requirement, and half think 1. So overall, it's between 1 mostly and 0. Those are in a nutshell, the results.
Great. Thank you very much, Melissa. And now let's see what we have from the CHS verification data. Helen, may I ask you to go to the next slide, please? So this is what we have. It's very small and difficult to see all the very well. But if we look at that, we see that you are right on the 6.1. You say 1. Many people say 0, but what we have here is 1.8. It's not the data here that we need to look at. It's the trend, because what we have here is verification data from 2019 and 2020. So it's the last verification that organization have done that we are looking at here. It's the most recent result that we have. And we can see that on the 3.6 and 5.1, when we say taking into account power relation and negative effect in area of culture, gender, social, and political relationship, is not reaching the requirement, because we know that when we are fully meeting the requirement is when we are at 3. 2 is that we are making systematic effort, but we still have some gaps. So we are under 2 here for the one for the taking into account relation and negative effect, and also for social and power dynamic must be assessed before deciding on the best way to connect, to interact with communities. We are very, very low on this one. This is the weakest that we see from the CHS verification data. We have better results on the organizational culture with complaints. I have to say that this is moving, this is evolving from the last verification. Also on the policies in place for security and well-being, we have better results. The one that is the best in this set of indicators that we have is the 9.1, which we say encourage stakeholders to report abuse and power. This is the policies are there. So this is what we want to see from the CHS. So we can clearly see that with the CHS, we have some elements already there. Some organizations are making efforts on it, systematic effort on the at least on the 3 last one that we have seen, and there are some progress also in this chart. We don't see how it's progress, but we can also see from the last the data that we have published in the HA and the data that we get now. There are some slight progress that we can see in the sector. So that's a good news. That's encouraging, but we all see that we are not reaching the full compliance. So we still need effort to do. With that, I will hand over to Melissa to continue and share concrete experience from CHS verified organization. Thank you.
Thank you. So I want to introduce someone who's very, very close to my heart, Reza from Coast. You're the director. I first got to meet Reza actually in Turkey at the World Humanitarian Summit, where you were advocating for people to pay attention to climate change. You've been advocating that for a long time, more than other people have that are later to the game. Also, I'm very grateful to Reza taking a lot of time within the Core Humanitarian Standard discussions to bring home this point on well-being. When COVID hit with lockdown, the CHS Alliance had a webinar on leading with compassion. And he came and he talked to us about how in the beginning of lockdown with COVID, he was working to make sure his staff were taken care of. And he was one of the 15 leaders that we interviewed for the Leading Well report. And one of his quotes is the most appreciated quote in the whole report, talking about how he has equity in how staff are supported. For example, when they're traveling, they have the same levels of hotel, food, etc. So a lot of discussion about equity, not just in the localization conversation, which is so important to us, but also in how we treat ourselves inside our organizations. And I'm so pleased he's agreed to be with us today to share his experience as a CHS verified organization on what it's been like to look at the culture, power, and well-being. In particular, one of my favorite indicators, 8.9, that policies are in place for the security and well-being of staff. We have a policy of zero tolerance for harassment and abuse, including sexual harassment and abuse in the workplace. So without further ado, my friend Reza, over to you. And please unmute yourself, or I might start screaming in the middle.
Thank you, Melissa. Very generous introduction. My dear friends and viewers, this is a very good afternoon from Bangladesh. It's a very hot Dhaka now, 34 Celsius, and very good morning from in Geneva. So I'm happy, and I have been very happy to be here. And thank you so much for inviting me and for giving me presentation. And I hope you will enjoy the presentation with my broken English, because I have not graduated in English boarding English school and boarding school in Bangladesh. But I try to give a very good public speaker, especially in such a gathering in the West. But you know, sometimes I cannot overcome all the limitations, but I try. My children are very well conversation in this regard, because they are in capital city getting good English. So today morning, I after the wake up, I did a phone to my colleague. He was with his son in a hospital for last 3 days. His son is sick, and he has to did the operation. And I inquired about everything, and he said that he will be releasing from the hospital. So, but this is my usual practice. Whenever there is a someone staff and his family member extremely sick, and family member especially go to the hospital, I made phone call. But during this COVID-19 situation after March 2020, we have developed new code of conduct, including the health protocols. We have revised it, and we have developed a system commissioning, implementing the disinfection system in the whole over our official offices and residences and training centers. And every day there is a format. They are measuring the temperatures and other 5 indicators which is related to the COVID-19. And if they found any fever and anything, they immediately send a staff to the quarantine, and they report to me in central office with their phone number. And every day, one of my responsibility talk with those staff who has gone to the quarantine and who are suffering. I first ensure them, don't worry, all of your health costs we will provide you. But what is the situation now? We have decided 2 leaders in each of the regions. We are working in 5 regions who will take care of them. We have the list of ambulance. We have list of hospitals, including, especially in Cox's Bazar, there are NGOs and UN operating a lot of quarantine centers and hospitals. We send our staffs to there. By the grace of God, so far we had to send only 1 staff up to the ICU. It was very life and death situation. In every hour by hour, minutes by minutes, I had to guide him. And Fortunately, by the grace of God, he has been released after 10 days. He was in oxygen and life support for 5 days. So nowadays, I feel that our staffs are habituated on quarantine protocols and health protocols. They wear masks, and so far so good. Only we have now four COVID patients. I every day inquire them, but in our country, although we have a neighbor India, the situation is terrible there. But still, I consider our infection rate is very good. Very low. And fortunately, we have the vaccines. In Cox's Bazar, most of our field staff 2-time vaccinated, AstraZeneca. And fortunately, my family is also fortunate. In Dhaka, me and my wife and my 2 boys has vaccinated 2 doses with AstraZeneca. But still, we maintain the health protocols strictly. Why I do this? I was part of the CHS when it was HAP, Humanitarian Accountability Partnership. Especially, I love to say that I was part of the when HAP was transformed to the CHS. Formulation of new standard, this CHS, and also the new secretariats set up, including the merging of people in aid with the CHS. So there was an action recharge. What will be the new indicators, new commitments, and I feel I was very fortunate. I was part of that, and I was also for some time with the board of CHS. I was very privileged to work with Alan and Bona, Tanya, and others. My issue is that why I'm here. I'm not by accident. I didn't came in the humanitarian sector. It is my interest. During my student life, I was a political activist, and after that, I was doing very high salary job with the international agencies, Danish international agencies, international development agencies, and then with ECHO in countries to famine-prone area. But later I realized that I should not be an international expatriate. Sorry, I like that, but I said that I can do something for the coastal people, branding myself a local NGO. Then with the encouragement of ActionAid, I gone to Bhola Island, which is 600 kilometers from the capital. It's needed river and journey, 18-hour journey. They have given me a responsibility to nationalize that NGO during 1994. Or if you fail to do it, come here. We have a good job for you in ActionAid in Dhaka office. So I gone there. There are a lot of ups and downs, but we have succeeded. I personally myself reduced my salary 3 times. I gone there with my wife without electricity, in no telephone system in Bhola Island, and we have succeeded during 1998. Up till 2000, ActionAid was supporting us, but after that, we are self-sufficient. We do progressive microfinance. Out of microfinance, we don't do any big buildings and cars and others. We invest our money first for our sustainability, second for asset building for our poor families. We believe in policy advocacy. So that's why we do mobilization in local level, national level, and international level, until and unless policies are changed of the state. We hold accountabilities of the states, and there will not be a sustainable development. We believe in localization, but it does not mean that we want to overthrow the UN organization, INGOs. We need very much UN agencies and INGOs for technical assistance, for monitoring. Sometimes I feel hesitate to participate in the discourse. We are Southern, we are Northern, we are East, we are West. I believe that we are very international. we are humanitarians. So these are my values, profound values. I love to say that within our organization, to satisfy us and also to satisfy donors, we have had around 200 pages of values. Of course, these values has prepared in a very participatory way. Before giving it to the trustees to approve it, I read it very carefully. But after that, I can tell you I don't read it. But I feel that I'm accountable to myself first, then to others. And some of the people telling, like Melissa, that we are doing well. Thank you, Melissa. Okay, next thing is that I can tell you is what we call the report during this COVID time, 2 years around, 1.5 years, 18 months. This is a very good report, especially CHS and ICBA. I congratulate you. This is the report. I can tell you in last 18 months, I gone through these pages and pages. Especially, I'll request you to go through the section key challenges. What are the disruption? How we can make power balances? Why we will collaborate each other, not competing each other? And bureaucracy is a necessary evil, but it is needed. But we have to do something so that we will be nearer to the people. How we can sacrifice even without our own well-being. So these are the challenges. I will draw your attention. There is another one, next section, that how we can model ourselves. And these are the new things we had to address our staff mental health. We have 76 Zoom sessions with our staff, how to take care during the quarantine period, during the lockdown period. We have now semi-lockdown situation. This is a new learning for us. We have to recognize the contributions of others, and we have to keep us as an executive low profile, and how we can challenge the inappropriate behaviors. I have not seen very much inappropriate behavior. As a CEO, how we can use our position responsibly and fairly. I believe in one issue that if I'll take care of my staff, my colleagues, our staff and my colleagues and their families, they'll take care of the affected population. So active listening, this is the fundamental skill. Community dating. We have the open communication. I'll tell you later on how we have integrated in our organization. Prioritization, staff care, staff well-being is the priority issue until we are able to eradicate the COVID-19. So how we can develop the compassionate culture. So I will request you to see this report, especially 3 interviews from Oxfam Chief Executive, Christian Aid Chief Executive, and Action Aid Executive. So I praise CHS and ICBA for this report, and Melissa and others. You did a wonderful job. So these are the very timely effort which CHS came in. This is needed. So CHS proved that it can go with the situation. So the situation is not normal. You have addressed this, and this proved that CHS commitment can go with the time, can go with the challenging situation. Okay. The next I want to tell you how we have developed our organizations. My perspective. I believe in equality, human rights, and democracy. And I believe that first I have to accountable to my values, then to other stakeholders. Then how we have integrated separate course of actions in our organization. malicious, there is indicator that open communication, we said that cross and open communication, but line in decision in line. It means anyone can communicate with the chief executives, but decision will go to the line of our organizational structure. My phone number is with our member participant, it means beneficiaries, and my phone number is with our all staffs. And second thing, I love to say, I want to make my culture. I'm not a hotshot person. Anyone can access to my mobile phone, my office, anytime. So we have an organizational policy. You right to know for the stakeholder, for the staffs. When we have formulated it, we have a very minimum exception. If only the government legal authority comes, then we are bound to give all the information. Otherwise, we give all the information except staff personal information. And we have a complaint response mechanism in different aspects. Especially, it is very easy, accessible in local language. I want to show you my visiting card. So I don't know whether it will be shown. Okay, look, this is my business card. My name is there, phone number is there. In other side of the business card, if you identify, there are 3 languages. One is Myanmar language, one is English language, another one is a Bangla language. It's telling that this is our complaint response process. Anyone, any of our staff, wherever they go, they're having this business card. They're bound to show this. They're bound to give it to a stakeholder. It is having a 2 impact. One is our stakeholders, our member participant, beneficiary getting access. And then the person who is holding this business card, he has the feeling that he is responsible to, accountable to all others. And it is making our life easy. We have a monitoring unit, we have a learning unit, we have a meal section, but I can tell you our cost is very low because we are promoting, I want to tell it that the countervailing power in organization. Whenever I visit the Rohingya people, when I visit the stakeholders, when I visit our families, I provoke them to have the accountability from our staff. I provoke them to have the accountability from me. I check whether they have my mobile numbers. So in our organization, we call it, we are having a countervailing power. I started with my statement, organization is necessary, but it is a bill. You need it, but it is a bill. So what you can do, you can minimize this bill through all this process. So in such a way, we are building trust and we are building accountability, but it is always mutual. I'm accountable to you, you are accountable to me. And at the end of the day, we believe in one thing. Maybe we are not believing in charity. We believe that affected population has affected by disaster made by nature, by disaster made by our whole human race, because there is a multiple level of denial of their rights. We are here to realize this. Thank you very much. Bye.
Thank you so much, Reza. That was so powerful to see on your business card, not only that you have different languages that are locally accessible and internationally accessible, but that you welcome complaint. It reminds me of a book that came to my attention by the director of CHS Alliance Secretariat, Tanya Wood, the book called Radical Candor, where leaders, managers, and others are really encouraging people to be honest in their feedback. By giving others feedback, first they ask, can we get feedback on ourselves? So in the chats, we have a comment from Amina Belkiria. Taking care of your employees, especially when they are going through difficult times due to family issues or other problems, is the basis and the beginning of good working conditions and good caring management. So nice work. Sophia Gland has said, really great idea to have the complaint mechanism behind the visit cards. So well done. And Alan, thank you, Reza, well said. So thank you so much, Reza. Considering the time we have, I'd like to turn over to our next segment of this conversation. So it's really going to be interactive. We have a good sized group. We're going to break out. But before we hand over to Bona to explain what's happening, I just want to acknowledge our breakout group facilitators that we have with us today, Alan and Anne-Sophie. Now, I'm not going to give an official bio because they'll introduce themselves in the chat, but I feel so happy that they're with us today. They were both very supportive of the initiative to cultivate caring and compassionate organization from the very inception when we started reaching out to people in our sector saying, are you interested in well-being? Is this something you want to spend time on? And both of them have been staunch supporters. Alan from LWF, a board member of the CHS Alliance, has been really willing to share his expertise, to connect us to his CEO for the Leading Well report, and to talk about, for example, the learning of faith-based organizations and how they deal with culture of compassion. And Anne-Sophie from Plan International, I've worked with for many, many years on many different projects. And this one in particular really helped us to launch the Working Well report that kind of set the stage for the vision. So they'll introduce themselves more formally. I just wanted to thank them for being here today and then to hand over to Bona to explain our next steps.
Thank you very much, Melissa. Yeah, as Melissa said, our next step will be to have interaction with you, to have your views on topics that are covered in the CHS. Helen, please, can you move to the next slide, please? Yes. So as I was saying at the beginning, we said we have these 3 topics that are covered in the CHS, but we would like to hear from you also about 2 elements. Now, first, let me remind you the topics that are there. The first one is accessing and considering social gender-related and power dynamic within the community and within the organization that Anne-Sophie Lois will be facilitating in a few minutes. Then we will share with you the links to go to the breakout rooms in the chat in a few minutes. And the second one is creating culture of open communication. And Alan Kalma from LWF will be facilitating that. And then we have the third one, which is establishing and applying policies for the security and the well-being of staff. This is where we will be talking about the zero tolerance for no action on harassment and abuse. And Melissa will be facilitating this conversation with you in the breakout room. We would like to allow now, because we are a little bit behind the schedule, we want to allocate 35 minutes for this discussion. And now I would like to tell you what you will be discussing in the breakout rooms. Ellen, could you please move to the next slide? We have 2 questions for you. The first one is, what are the opportunities and obstacles to fulfill this part of the standard? This part is the topic we'll be discussing. And the second one is there anything that needs to be added or strengthened in the CHS in this regard? So we would like you to manage the time to try to get answers for these 2 questions. Within the breakout rooms, the facilitator will tell you, but we will also like to have somebody as a reporter to come back to the plenary session and feedback the plenary with the most element discussed within the group. So I think Helen is sharing now the links to go to the breakout rooms. Now I will invite our facilitators to join the breakout rooms to be there and welcome the participants when they will be coming. So we have three colors. The first one, you can see that in the chat now. The first one is the gray on the first topic, social gender related and power dynamic. This with Anne-Sophie. We invite you to choose the one that you would like to join. It's free. You can just select one that you want to join, clicking on the link and joining the group. When you will be finishing, you will also receive the link to come back to the plenary session. When you click on this, when you click on the link, if you have a blank page, just refresh your browser, and then you will get into the breakout room. And at the end, you do the same thing to come back. You will receive the link, click on it, and come back to the plenary session. So I will invite you now to join the facilitators in the breakout rooms.
Great. All right, we're all here. So Bona, do you want to guide us through this final wrap up?
Great, thank you. Welcome back. And I believe we have a fantastic discussion within the breakout rooms. Let's feedback the audience, the plenary, with the main point that you have discussed. I would like to start the gray group, the group one, the group of Anne-Sophie. And I've been there, so I know, Sika, you are the rapporteur. Let's hear from you about the main point discussed in that group. And then we will move to the other groups. Let's keep it very brief because we are a little bit behind the schedule. Thank you.
Thank you, Bonaventure. So in the gray group, we discussed about the standard on power and social dynamic and genders, right? And our main takeaway is that despite the challenges, there are opportunities to strengthen this value inside the organization. The first is to woven this value and the practices attached to this value into our existing system, including the performance assessment system, the existing core training and workshop that we have in the organization to take this moment, to learn and to reinforce this message in the organization. And also using the attitude of our leader to shape and model this value in the organization, starting from decolonizing the leaders' use of their power and decolonizing our attitude in general in the sector and in the organization. One thing that we all agree on is that the power lines need to be strengthened in these standards, such a way that it can really address and look at power and privilege pattern and dynamic, and moving into it, addressing gender-related age, race, coloniality, etc., more strongly. And finally, we have a larger reflection about why this specific, standard is not at the heart of the organization way of working, is simply because the organization success and organization success are not assessed, against this standard. The success is measured against how many, funds you have been able to raise as, a chief or a CEO or a director, but not again how well your staff is feeling the well-being of our staff. And until this specific, success dimension is not woven into the sector, people will really tend, to have, harmful behavior exercise just to make sure that we achieve, success in raising more funds for our organization and competing also with local organizations sometimes unfairly. So we'll stop there.
Thank you very much, Sika. Thank you for
Anne-Sophie and others in the group. Yeah.
Thank you very much. I noticed 3 things from what you said. Attitude, working on our attitude of leadership is very important. You told us local powers, to how do we raise that local powers. And the last thing that you said that is very interesting, how do we shift the way we see the success of the organization, taking that like accountability to people, and we should be the way we see the success. Thank you. Not only about the amount, the total amount that we bring to the organization. Thank you. Let's move to the big group, the group 2, the group managed by Alan. Alan, who is the rapporteur from your group to feedback?
That's me. Hi, everyone.
Yeah, great. So, Fiona.
Okay, Flora, yeah. Okay, so we were looking at how do you build a culture of trust and open communication within an organization. And in classic style, we spent most of the time talking about question 1 and didn't quite get to question 2. But so we had a really good discussion about some of the barriers to that, because I think everybody recognizes that this is what we want, is a culture of trust, but what is it that gets in the way? And we talked about how hierarchical structures get in the way of that, and those can be within the organization, but also within the culture of the society around that. So it can be quite difficult to give really constructive 360 feedback, for example, to somebody who's an elder to you, or a different female to male. All those power dynamics play out in practice between individuals, so that the best possible system in the world, for example, for feedback and performance appraisals, it doesn't work fully in those kind of environments because of that. We were also talking about high turnover and how there can be a perception of there being a lot of investment in individuals and then they move on, but actually we're all investing in the same things. So as a sector, can we be thinking more about that being a contribution to the sector rather than just into our own organizations? And can we be more connected, for example, around inductions and training, so that they're really benefiting the sector as a whole? What else did we say? We talked about who needs to take the lead in creating the culture for these kinds of open conversations, and there was a really good discussion around that, and a really good point raised about, can donors do more to support this? Because if it's stipulated by donors, then that's a push and a mandate to organizations to respond to that. And then we talked about as well that can be reinforced at all levels. So leadership, HR, management, each of us as individuals can play our part. But that there are so many priorities competing for everybody's attention. And it seems like every year there's a new kind of theme. Maybe it's violence against women, maybe it's, I don't know, localization, maybe it's something else. And you sort of, it feels like we switch our focus very, very quickly, which leads into the other point, that creating a culture of trust is going to be a long-term endeavor, and it's going to require persistent, consistent, intentional sort of effort over a long period of time before people can really see and feel that whatever feedback they might feel brave enough to give is going to be received in the right way and not have negative repercussions. So it needs to be consistently done. We talked a little bit about COVID and the pandemic and how that's played out, particularly around use of technology in these kinds of virtual conversations, and how in some ways that can be really empowering to hear voices that might not be heard so clearly, or being in the room with other people of power. So particularly connections with country teams and connecting country teams to HQs. I love the term that for some people it demystified HQ. So country people kind of understanding a bit more how things work at HQ level. Then we did talk a little bit about the second question and what can the CHS do to support this more. And really our reflections were that the way that the standards are worded is very much focused towards the beneficiaries and the people that we support, which is absolutely right. But could that be also extended and reflected to the staff and the way that we talk internally and communicate with each other? We started a conversation about, can we collect some data and measure this? Because we know that management loves to see evidence and support our case with evidence data, and we struggled a little bit, ran out of time to fully explore that, but we did think that we could get some qualitative data from staff surveys, but quantitative data might be more difficult. That's probably enough from me. Sorry if I've talked too much.
Thank you very much. Thank you. We are conscious of the time. We need to move to the last one. I would really like to hear the last one. But from your collective effort on induction is very the donor's role that you said, demystifying HQ. I like that. Let's move to the third one. Melissa, how is the...
I'll take the mic. I'm Sophia.
Great, thank you.
Yes, so we were three with Melissa and Mayumi. Unfortunately, Mayumi couldn't, had a problem with the audio, so she wrote, but and I would have loved her to report that session because she wrote very important insights. But please jump in, Melissa or Mayumi, if I miss anything. So it's really linked to what have been said previously, but I guess I can say, well, we discussed three main points. And the first is when we talk about well-being, what are we looking at? And the fact that Mayumi said, we are always, or Kat was saying, sorry, we are always looking at the worst broken points. And I think that resumed very well what we talked about, the fact that we know that in the organizational culture, there is a lot of issues in regards to bullying, to intimidation, to toxic environment, but our priorities, it's competing priorities with like safeguarding and scandals and what goes as a scandal in the INGO. And so it would be very important if we talk about a zero tolerance on well-being, it would be very important to try to be as explicit as possible, I guess, but still not too explicit, to not go to a too narrow context, but really ensure we have a collective understanding. And then we talked about the fact we came back to decolonization and how we can standardize or harmonize without imposing a Western culture or a certain culture on the others and on the understanding of what well-being means. And then we came also, we talked about you. Melissa brought you in the discussion because we talked about like giving the power away or releasing the power. And in the spirit of decolonization, it should be more, in your words, releasing the power, accept to release the power and to drop the privilege. So just to give the space to someone else, right? And try to break the us and them dynamic that we can find in organization. I don't know, I can, Melissa or Mayumi, would you like to join in the debrief, bring something?
You did great.
Yeah, thank you.
Great job.
Good. Thank you. And we are now over the time that we have. I just want to thank you all. And then I've seen that you had a good discussion in the breakout room. I'm very pleased to hear that. I'm taking three things from all the discussion. The first one is the focus on the people and the putting that in the system as earlier as possible to make sure that that will be done. The second one is measuring progress, and I hope CHS verification can help doing that. And the last one that you said about the decolonialization, releasing power, giving the power to local people, and all these things will be taken and used for the coming CHS revision when that will come, to make sure that everything that we are learning and discussion now to feed into the revision process. Thank you. I would like to go back to give the floor to Melissa for the closing now. Thank you very much.
I just want to thank you all for bearing with us as we learn a new platform. I saw some of you really wanted to dig deeper in that slide Bona shared at the beginning, his analysis with Adrienne Muretet of the verification data on the indicators related to care, culture, power. We have recorded the session in part so that we can take good notes on the rich discussion. We will have a summary report about the global gathering. We will have this video on the YouTube, and we will try to find ways to continue this conversation that really get at the root of how power is imbalanced in our sector, and that manifests in our daily life and how we feel as staff. So just a big thanks to my co-facilitator, Bona, to our breakout groups facilitator, Alan and Anne-Sophie, and to our rapporteurs, and to those of you who participated. For me, it just means I want to keep going. I want to keep this conversation happening. So big thank you to you. I think now we have a pause, a lunch break, and we'll be starting back in about an hour for a community information exchange. And the idea of this exchange is people in the sector who are working on well-being, who are working on culture, equity, decolonization, these things, who are providing services in mental health, etc. We just want to provide a space for an exchange between these, I would call them feelers and healers, to see, can we connect and maybe better collaborate? So you're more than welcome to join us there or our sessions later today. A big thank you to everyone, and enjoy a nice break. Bye. Thank you. And thank you to Reza, of course. I can't believe I forgot. Reza, thank you so much for your excellent
No, it's my pleasure. Oh, great. Well done, well done.
I know, I just have a lot on my mind at the moment, and then I always feel bad afterwards. I'm like, I forgot. But thank you, Reza. I appreciate it. Enjoy your nice weekend.
Thank you.
Bye.
Thank you, Melissa. Bye-bye.